Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dall Simons Family Studio, looking for the sun. Not seeing it for the next few days, it looks like, but we're here. We're going to provide our sunny day entry into all things COVID as we go about and talk about the things that are going on out here in our healthcare environment. You may not be aware, but this week marks the 46th annual National EMS Emergency Medical Services Week, a week President Gerald Ford authorized because of all the great work that emergency workers do to keep us healthy and safe in our communities. We have invited two of our outstanding experts to explain how challenging COVID-19 has made their jobs and the jobs of all of our emergency medical workers throughout the pandemic. In studio, Dr. Chad Cannon, our chair and clinical service chief of the Department of Emergency Medicine, and joining us by Skype is Dr. Ryan Jacobsen, EMS Physician Advisor to the Health System and Medical Director of the Johnson County Emergency Medical Services. We're going to get to their conversation in just a moment, but first, Hawkeye has some important information for us. But first, we're going to reveal a fact about Hawkeye that we didn't know before. And I don't know what this means about him. I'm a little concerned.
Yeah.
He's got a Chicago Bears belt on.
Yeah.
So I said to him, who will you cheer for between the Chiefs and the Bears? And he said, a good game. I think everybody at MMU, all of our audience, needs to let Hawkeye know that it is the Chiefs we cheer for, Hawkeye.
Yeah.
I'm just so stunned.
We'll cheer for the Chiefs. Yeah, I don't have a problem. They're two different conferences. I want them both to be in the Super Bowl.
Patrick Mahomes.
I think that would be a great Super Bowl. Yeah, okay. Patrick Mahomes, best quarterback in the game.
Who's going to win if the Chiefs? Who would you cheer for the Chiefs and Bears play in the Super Bowl? See, he stops. I'll
say the Chiefs. Man, it's my formative years, right? The Monsters of the Midway.
Oh, it is hard.
85 Bears. All right.
There you go.
But I would love for both of them to get there.
I would love. That would be a fun time, wouldn't it?
Yeah.
Kansas City, Chicago. We'll win.
Yeah.
Okay. How are the numbers today?
I'd be happy with that.
We're all winning right now.
We are. The numbers are much better than they were. 9 active infections with 3 in the ICU and only 1 on the ventilator, which is good. 11 in that recovery period, so 20 total, and then Hays has 2 active infections and 1 in that recovery period as well.
And out of the 9, a number of those people are they're here for something else. We just happen to find they're positive on their admission screen.
Yeah.
So really the sick isn't even 9, it's less than that. So, I mean, to me, we're not doing a lot of testing out in the community and as much as we were, and it's hard to know what's the real seriousness of COVID-19 right now. What's the bellwether? I think the number of patients in hospital beds is the bellwether, and we're clearly down. Yeah,
and I'm glad you mentioned that because we were for a long time we were only using 1 unit to house our COVID patients. 4 or 6 weeks ago we had to go now to 2 units. Now we're back down to 1. So of those 9 patients, only 6 of those are on that 1 unit, and the other ones, just like you talked about, were found on our admission screen because we still are checking everybody who's admitted for COVID-19. So we still know that it's prevalent. I mean, that means it's still prevalent out in the community and people are still getting it. But just to your point, as far as the sick patients, and we will continue to update as well on what is their vaccine status and ages, probably on a weekly basis as well.
There you go. Cubs or White Sox?
Royals.
Well done. That's a guess. You did good. Well done.
Royals for sure.
Wyatt and Caroline, we have a photo of them from yesterday. If you weren't part of the program, this is Hawkeye's children getting their vaccines.
And I would like to say, too, on the way, I had to drive my daughter to school today, and on the way to school, she actually asked me, she goes, when should I start feeling symptoms? So they did have some sore shoulders last night, but and I did talk to my son this morning. He did not have any other fevers, chills, aches. So I was actually happy she asked when she should be developing those symptoms. And I told her you should be developing them by now. By midday, you're probably out of the woods and you're probably not going to get any of those aches, chills, fever, headache, or anything like that.
So really
doing well.
And so we are so fortunate. Thank you for, first of all, helping your children feel safe to have that vaccine, and second of all, allowing them to have it on the program. And thanks to them for volunteering to come onto the show and even have to listen to some of my singing.
Yeah, she loved it. But I would like to also say, that this will help them moving forward during the summer for vacations. It also helped my daughter with her activities and not being held out from participation in that. She likes to do horse riding, and my son for camps that are coming up for football and soccer, and also soccer games. And he's got a tournament game this week actually for State Cup for soccer. So, we feel confident now that moving forward, especially not in these 2 weeks and he's not fully vaccinated, but moving forward, he will not be held out of participation because he's fully vaccinated.
Yeah, well, that's good stuff. All right, well, let's see if there's reporter questions out there this morning. All right, no reporter questions, but we got some good people right here to talk to. Chad Cannon. First of all, how are you, sir?
I'm doing great, thank you.
All right, Chad is an outstanding chair of the ED and a good friend of mine, and we're delighted to have him on this program. He likes to go fishing as well, as I recall. So how is the ED, and how has it been working with you all for those COVID patients?
The ED is doing well. When this all started, the volume of the patients was down a little bit. We were actually down about a third, and it sort of recovered over the year, and we remained down about 10%. But the last quarter, we're back to even. We're back to where we were before. So patients are coming back, and that's a really good thing.
Yeah, because we want folks to, when they're sick, to get here. We don't want them to delay care. And so as they've come back, are they coming in sicker, or kind of like they used to be? Because I know for a while, the patients who did come, they were really sick.
Correct. When our volumes are down, they were coming in sicker. But now they're back to our normal acuity.
So kind of resumed habits.
Correct.
Good. And how safe was your staff throughout COVID-19? Because, man, there were patients walk in, you didn't know if they had it or not.
Our staff were extremely safe. We only had 2 or 3 staff go out with COVID on the provider side, and all of them we traced back to someone in the household who had it prior to them. So we're not aware of any staff that came down with COVID while they were working clinically. We're not aware of any patients in our ED that acquired COVID while they were in our emergency department.
Yeah.
I actually think being in our emergency department is one of the safest places to be because 99% of our staff are vaccinated, and we all have a mask. We have a second layer of protection.
Yeah.
So it's a great place to come receive your care.
And for your team and for you, how's the nursing team doing and the support team down in the ED?
They're doing well. They're so important. And the nurses are even closer to the patients and interact even at a higher frequency than the providers do. So they're really amazing.
Yeah. Is there a sense of PTSD? I mean, is it the emotional toll? Talk to us a little bit about that.
I think initially there were so many uncertainties and unknowns, and now, but in the emergency department, we're used to taking care of the unknown. We're used to taking care of communicable viruses, measles, mumps, and chickenpox, and influenza. So I think it wasn't as difficult for us, but certainly the unknowns infected all of us. But I think now we're back to just a normal day job.
Yeah. So as you look across the landscape, is this the hardest thing you've had to do in your career in medicine?
Without a doubt. Without a doubt.
Yeah, I bet it takes an emotional and just a toll on your. It's an exhausting thing. So we had developed that super cool separate triage space for the ER when COVID was starting to rocket up back in April. You still using that for COVID? What's going on with that space? Because I don't think we tore it down.
Yeah, so we converted our 4 ambulance bay into a special area, and this was literally built in by the architects and construction crews in a weekend. And we have 12 beds in that area, and we initially used it for COVID patients because we thought everybody had to be cohorted, but we soon realized that we have to treat every patient as a potential because we didn't. So many were asymptomatic. So we've converted that area now. Everybody who comes in the ED is treated everywhere, and that area is primarily used for more lower acuity, given that we don't have monitors and some of the advanced equipment. So we're still using that area, and it's really keeping the flow in our ED, maintaining that, because it's essentially expanded the size of our emergency department.
Yeah, that is really cool. And are the floors still cement, or are there televisions in those bays yet?
No, we have a new floor put in. We have the walls are painted.
Yeah, so it's come a long way. Yeah, and are there TVs?
Well, not in the ambulance bay.
Okay. All right. I had to make sure.
But we will have them put in before the Chiefs start, though.
Yeah, or the Bears. All right, Dr. Jacobsen, thank you for all your great work in the county and the state, because I know you do a lot of work on EMS planning throughout the state. Talk to us a little bit about the toll and the work during the pandemic and what you've been doing.
Yeah, it's taken a huge toll. I think to Chad's point, EMS, the folks out in the field are used to taking care of unknowns. Someone calls 911, we show up and react to what's happening. I think the uncertainty about how contagious this was, airborne versus droplet, the early discussions that were had, what kind of PPE to use was one of the huge issues. You know, you're in a box. The back of an ambulance is a box. You're with a patient. And simple things like giving an albuterol inhaler, putting people on CPAP, how we bag people or, you know, breathe for them, putting filters on devices that we normally never had filters on. There were so many things that we had to change in real time and very quickly. And then the supply and logistics issues as far as getting that equipment on the fire trucks and the ambulances, it created a lot of stress and anxiety. I mean, it's been an incredibly challenging year.
Yeah, that is so true. Talk to us a little bit about how did the state survive with COVID? Because, I mean, just transporting patients with COVID-19, man, that was a trick, right?
Yeah, absolutely. You know, one of the best things that came out of COVID, you know, the tragedy that it is, you know, the high flow nasal cannulas. We can't do that in the ambulance very well. So transporting patients, we can't transport patients in a prone position on their bellies, you know, for oxygenation. There's a number of limitations for EMS in the field that we just can't deliver the same level of in-hospital care just for logistics. So we had to react to all these things and talk to our peers across the country around how we were dealing with it and handling it. How are we recalling the ambulances? It was really challenging, but we did have a lot of contacts with other EMS medical directors and service directors across the country on how we've been dealing with that. So I think the relationships made there were enhanced, and I think that's one positive we can take away from this is the enhanced communication across the country on how to deal with these issues.
And so what changes did you guys put into place, do you think, are going to stay with EMS services around and the transport of critically ill patients?
So I think the penetrance of trying to get the providers to mask themselves during flu season, during viral seasons, and masking the patient was always kind of challenging. Historically, we never really worried about that in the EMS realm. It was much more, they're much more cognizant about that in the hospital environment. I think that's here to stay. I think every patient is getting masked. I see on scenes, I see our providers universally wearing all the respiratory protection and eye protection. And I think that's going to be here to stay. I think we're going to impact our flu seasons by masking, and I think we're going to have less days off work from our providers in future viral illness seasons because of the masking. I think we're going to, that's one of the things I think is definitely going to stay with us.
Yeah, I think that certainly makes sense. And I know I'm happy not to have had the flu or cold over the last year. That's just been great. I haven't missed it a bit. So we're hoping and crossing our fingers that COVID stays low, but we all have to get vaccinated. Are you guys been active at all? I assume you're both vaccinated. Yeah. What words of advice do you have for our listening audience today, our viewing audience, about COVID vaccines?
Well, we had really good uptake in the fire and EMS services. We had 85–90% of our providers and the EMS agencies in Johnson County get vaccinated, which was really impressive. EMS has also been doing standbys at the vaccination clinics that the health department in Johnson County has been putting on, and working with Children's Mercy and the school districts in Johnson County as well. So our paramedics will do standbys and assist facilities that need emergency equipment just on standby for those rare potentials. But usually, you know, they get calls for someone who had a dizziness episode or something after the vaccine very rarely. But EMS has been a strong proponent of that, and we've had really good uptake in Johnson County on the EMS side from our providers.
Yeah, great. Anything else you want to add, Chad?
Our staff, we're about 99% vaccinated, our staff.
That's impressive.
Only those who are choosing not usually have a medical reason not to. I'm really excited today. We're actually starting to vaccinate in the emergency department for our patients.
Yeah. That's a big deal, by the way. That
It's
is
so
a big
exciting.
news. Yeah.
I mean, clearly we have ample appointments available with the health system and in the area. So this isn't because there's not access to vaccines, but we have some patients that are underserved and may not have transportation, and they're there for another reason. And we're identifying those and giving them the opportunity. Yeah. And then they have the opportunity to talk to somebody immediately if they have questions about that. So we're hoping to increase awareness and increase uptake.
That's great. And so are you doing Pfizer, Moderna, J&J?
We're doing Moderna.
All right. Awesome. And then how do you arrange for follow-up vaccines?
The health system is providing in the discharge instructions places for them to go here locally.
Yeah, because I know we would help offer that. And just reminder, even if you get one of those, you're still better off than you get none of them. In fact, one of the Pfizer and Moderna may be the same as having one of the J&J. Well, we're still waiting on some of that data to come out, I think. So, all right, well, this is great, and we're very fortunate to have you all on the program. Jill, let's see what questions are out there in the community.
All right, today Isaac wants to know, he goes, I know a lot of things are better on the COVID front now that they were back in winter, but for those not in the know, are they still afraid to call 911 for non-COVID related issues for fear that they're taking up a bed?
Oh, I think we're okay with that. What do you think, Chad?
I agree. There was a period of time when the hospital was full, the emergency departments were full, and we did have to make some difficult decisions about who needed to be managed inpatient, who needed to be managed outpatient. But now the capacity's there now. We have the capacity. I certainly would not recommend anybody delay care for emergency care and to come in if they feel like they need to.
And Dr. Hawk, you and I mean, you're up on the floors frequently.
Yeah.
We're full again, but it's really not with COVID anymore.
Yeah, no, I was talking to our hospitalists who, again, were on the front lines as far as the providers seeing our COVID patients, in addition to the nurses who are in those rooms for hours on end. And they are happy because a lot of our volume now is typical medical problems that we've seen, medical surgical issues, and that's a good thing. So hopefully we will continue to get those people when they are having those problems. If they're having chest pain or weakness on one side, come early, get evaluated for heart attack and stroke, because we saw that was a huge issue in the initial parts of the pandemic because people were just afraid to come. But if you're having issues, increasing abdominal pain, otherwise weakness, confusion, heart attack symptoms, shortness of breath, anything like that, please come get evaluated. Because we can do safe evaluations, and more than likely we are going to have some intervention to get you through to another day, get you feeling better, treat you appropriately.
Maggie wants to know, are EMS workers ever afraid of exposing themselves or family to COVID?
That's a great question. Dr. Jacobsen, what do you think about that?
Yeah, absolutely. That was a very big issue for our providers early on. We had providers that were staying in hotels after their shifts, being away from their families. We had some departments that were putting their providers up in separate housing so as to avoid any potential exposure. And there was a lot of fear. So yes, early on, I think that's gotten a lot better now that the vaccine's out, and we've got good PPE and ways to prevent exposure of our providers. But absolutely, initially there was a lot of fear, and there were a lot of EMS providers not going home in between shifts out of concern for their family.
That'd be so hard. And Dr. Cannon, what are your thoughts about how did our AD team respond to that too? The same question about how much fear was there at the beginning of COVID, and did it affect behaviors?
No doubt there was the unknown that created a lot of fear, and we did have many providers who chose to sleep in separate bedrooms or stay in hotels. Certainly we had folks that were changing their clothes in the hospital and not taking those home and showering. So a lot of these things have resumed to normal practices now, but I think we're pretty comfortable and back to a normal schedule now.
Yeah, that's good stuff.
Deborah says that she came to the emergency department, she doesn't say where, and she was admitted to the ICU with an extensive diffuse pulmonary emboli.
Yes.
Did I say that right?
You did a
Thank
great
you.
job. You nailed it.
And she said it was after she got her first dose of Pfizer. So now nobody told her that that's what caused it, but she's afraid to get the second shot.
Okay, well that's a really good question, and I'm going to assume that first of all, the fact that you had extensive pulmonary emboli means you're going to be on blood thinners, and if you're on blood thinners, then you can get the shot and not worry about it because you're already on blood thinners. I'm assuming, because most of the time, if you really had a lot of blood clots, then you're going to be on blood thinners for 6 to 12 months. The second thing is that people come into the emergency room or be hospitalized with different causes. You also want to always make sure if you have a blood clot, there's no underlying disease, because that's often the case, or that you don't have a hypercoagulable state. You have to make sure that's been evaluated through talking to your doctor. But but people come in like that without the Pfizer vaccine or without any vaccines or any other reasons. So while it is very tempting to link those 2 points together, we know that the incidence of bilateral pulmonary emboli, or blood clots into the lung, in people who get vaccinated is no higher than it is in the routine background of people who don't get vaccinated. So in other words, it occurs the same frequency as those who get vaccine and those who don't, Hawk.
Yeah, I think we have not heard or seen any reports from the World Health Organization, the FDA, the CDC, ACIP, anything about that, about safety signals for extensive pulmonary emboli after one dose of Pfizer vaccine as well. And that is going along with over 1 billion doses of vaccine in general given, but also that, that very small amount of cases of the sinus venous thrombosis that we saw with the Johnson & Johnson vaccine. So, I'm not really aware, and I would agree with you, true, but not associated with each other. True, you got the first dose of Pfizer. True, you had pulmonary emboli, but these are likely not associated with each other. I think you're still safe to get it, and to your point, you're probably going to be on blood thinners, so you would be okay as well. But so far, all that I'm aware of, there's no safety signals or anything, evidence of that, saying that Pfizer is going to help cause blood clots like that.
I've not seen that. And Dr. Cannon, anything you've seen about that?
No. I mean, we continue to see pulmonary embolisms, and I thought the same frequency as before the vaccines were started.
Yeah.
And to be fair, we know that, just make sure that you didn't have COVID before that as well. I saw a gentleman late last year who had COVID 2 to 3 weeks prior, but then came into the hospital because he was having shortness of breath. He was well initially with COVID, but it was at 2 or 3 weeks later that he developed those blood clots in his lung and had to stay here for 4 or 5 days and then eventually go home on blood thinners. So.
And Deborah says that is what the doctor told her, but she wanted to hear your second opinions from Dr. Hawkinson.
Now
and
you got
Dr.
second, third, and
Stites.
fourth opinion, so I don't know what that means. But
good to go.
Other
Get
than
that
you're
shot.
safe, go get your shot. You're on blood thinner.
Yeah.
Go.
All right. Vicki, and this is for our emergency physicians. What do you do, and what did you do during COVID crisis? I think we're not completely out of it, but what do you continue to do to keep the morale of your employees up? And how are they with their mental health? I think it's kind of a follow-up to the question that you asked him.
Well, Dr. Jacobsen, let's talk about the Johnson County EMS team. How do we keep the mental health up, and how is the mental health of your team?
Yeah, it's a nationally known issue that there is a suicide mental health crisis going on in EMS professionals across the country. They see and are exposed to incredible tragedy, dramatic events that are, by the time we've delivered someone to the hospital, the scene is very, very dramatic and very scary. When someone gets shot or someone gets stabbed, we see that home environment, that living room, that kitchen, the stuff on the wall. It's very much a different thing than having someone delivered on a cot to the sterileness of the hospital, if you will. So EMS has long suffered with PTSD and emotional distress and mental health issues. It's being addressed, it's being studied, it's being worked on. And one of the things in the EMS system in Johnson County, I'm very confident and aware of that we do utilize is peer support teams, and where we will take units out of service after a traumatic event or a bad call, for instance, a pediatric death or a pediatric trauma or some multi-casualty incident. And they'll spend the time talking to their peers who have training on how to deal with mental health crises and things of that nature. So it's something that we've identified as an industry in EMS that's a real issue. And we are taking the best steps that we can as we learn and grow about how to address that kind of stress in the EMS provider.
Yeah, and I am right there with you about all of those points. And I just got to say, it's got to be really difficult to walk into the scenes of some of the things that your team has to do with motor vehicle accidents or shootings and things like that. Dr. Cannon, how about for the team downstairs?
Well, I think we're communicating about this issue a lot more, and we're raising awareness. We're alleviating the stigma. This is not something anybody should be afraid to talk about. After some of these stressful incidents, we immediately debrief, which I think helps get people talk about it, not hold these things in. And then often it takes subsequent discussions. And we actually not just talk about it, we informally, but we actually have formal presentations and bring in experts. We make resources available to everybody in an abundant way. We put this on our agendas at staff meetings, at our resident and student conferences. I think all of this helps.
Yeah, I think that's right. having that, and especially for those young trainees, because some of them who lived through this pandemic, they didn't really sign up for that as part of a training program. They don't have the breadth of experience maybe to know how to handle that. How have your young team members, residents, and nursing staff, how have the younger folks done?
I think they've done fantastic. In the first few weeks, we initially thought we were going to try to shelter the students, shelter the residents, keep our trainees away from it. But we soon realized any patient could have COVID, and they actually wanted to get back in and do what they signed up to do. And so we almost couldn't keep our trainees away from the patients, and immediately we realized this isn't going to work. So our trainees, we had to hold them back, if you will, but we couldn't. And so that was the right thing to get them back taking care of patients.
You
and
bet.
They get a lot of satisfaction of treating patients and helping. And we're actually seeing more interest in emergency medicine. There's a sense of that the specialty, it's a relatively new specialty in the whole house of medicine, but we're seeing that this is a specialty that really makes a difference. And this crisis has taught us anything, is the importance of frontline care providers.
Yeah. Dr. Jacobsen, what's the turnover like in the EMS staff? Has that been a bad year? Has this been a bad year for turnover in the team? And how have people weathered that?
There is a national shortage of EMS providers. It's very hard for fire chiefs and ambulance service directors to find staff. It is a underappreciated, underrecognized job, and there's a very large national shortage of paramedics right now. And we have that same problem locally and regionally here in the state, where people are competing for the same pool of paramedics that come out of school. Yes, turnover is an issue. And while they're generally good jobs with government agencies or municipalities, it's a stressful job, and people oftentimes use EMS as a stepping stone to other healthcare professions. And in environments like this, where they're exposed to high frequency of illness, critical illness, and they're putting themselves in harm's way, sometimes that leads to the challenge of retaining folks. So yeah, turnover is an issue, and there's definitely a shortage going on in EMS right now.
Yeah, I believe that to be true. Fortunately, I think our ID team stayed intact. You guys have done well over the year.
Yeah, we've done well. We enjoy, obviously, the infectious disease aspect of it all. None of us signed up for this either, but it's been a good experience, and our morale continues to be pretty high in supporting each other and supporting our nurses and our support staff, and they have been great through it all as well. So, I think we are getting better. And to your point, a lot of this, and you were talking about the trainees, a lot of this also is a function of we learned more. In 2 weeks, we learned more. 4 weeks, we learned more. We had those systems in place. We knew how to protect ourselves a lot better than, especially in that first month. And so I think that has helped a lot as well.
Okay, Sean wants to know about the relationship between the emergency department and EMS a little bit more. He's wondering, as an advisor, what is it that Dr. Jacobsen is advising, and does he advise other hospitals or just us?
I know. Dr. Jacobsen has a broad influence. So, Ryan, talk a little bit about your work in the county and throughout the state.
Sure. So the primary role of the EMS medical director is to provide both direct and indirect medical oversight and clinical supervision of EMS providers. So, for instance, in Johnson County, there's about 900 EMTs, paramedics, and 9 different fire departments, Johnson County Medac, the ambulance service, and the 911 dispatch center. One of the ways in which medical directors provide oversight is through ensuring evidence-based protocols and guidelines for which the providers are using when they take care of patients, approving the educational content and delivery of CME, also doing performance improvement, clinical registries, tracking our cardiac arrest, trauma, stroke, STEMI data in the EMS community, our outcomes for survival of cardiac arrest, bystander CPR rates, AED use, things of that nature. And then credentialing, making sure that the providers are minimally competent in their skills and their knowledge base on a routine basis, similar to how physicians are credentialed in the hospital. We are dramatically have increased our communication with agencies like Marker, the healthcare coalitions in the region, the hospital CMOs and CEOs, and the public health departments. And so one of the things, both at the state, regional, and local level, is EMS medical directors have been a key liaison to the various health systems and hospitals in the area, because we are a big source of their patients to the emergency department, inputting them into their hospitals. And so we have to have that close collaborative relationship. So we work really closely with ED medical directors across the region. We work very closely with the administrations of a lot of health systems and hospitals in the Marker region. We also have a collaborative group of medical directors of EMS in the region. And we meet routinely and we discuss issues of transport, how we do interfacility transports between hospitals. And so there's a very important relationship there with the local EMS and the emergency departments in those hospitals.
Yeah, I think it's a big job, and I think we're blessed to have him here at KU. I know that's somebody you were delighted to recruit.
Do we have time for 2 more questions?
Yes, ma'am, we do.
Okay, Mama Miller said that her daughter is having issues after taking the Moderna shot, and she has this question. She said that the daughter had numbness on one side and that has been diagnosed with lupus, and she wants to know, is it possible that the Moderna could cause a false positive test for lupus? I think they're having and struggling with the lupus.
Yeah. So my short answer is going to be no. We know that lupus is a difficult diagnosis, and there are criteria to help diagnose that. I would assume and hope that you're seeing a rheumatologist. They are going to be the best person for that. But again, the components of these vaccines, Pfizer and Moderna, there's only like 9 or 10 components in each one, and really the only major active part or component of that is going to be that RNA, which then gets transcribed and translated to produce that spike protein. I don't think, again, just as we are going back to the diffuse pulmonary emboli or blood clots in the lungs, I don't believe that there's really any safety signals about that. And we know lupus is something that needs to manifest really over time. It's not one specific time frame, but there are probably signals of issues over time. So the short answer is no, but certainly talk with your physician about those types of questions, and that rheumatologist can probably answer those questions a little bit better. But again, I think right now we would still recommend going ahead and getting that second shot.
Last question.
Okay, Joni and Yuri, I'll get to your question about church and singing in nurseries tomorrow, but Sherry, you get the last question. Can you please define breakthrough infection? She read an NPR article about the Yankees team. Only one had symptoms. Everybody else was asymptomatic, and she thought breakthrough was only if you had symptoms, so she's confused.
Yeah, great question.
No.
Because we know you can get COVID-19 even after the vaccination. It just means you tend not to be very sick and you're not hospitalized, you don't die.
Yeah, I think that's the important part. This vaccination, these vaccines are going to prevent that whole spectrum of illness. Most of these baseball players are going to be young and healthy otherwise, so they would likely get less symptoms or barely any symptoms, but this vaccine now seems to probably have protected them from any symptoms at all. So breakthrough infection is infection after you're fully vaccinated, and that means 2 weeks after the single dose of Johnson & Johnson, or it's 2 weeks after that second dose of Moderna and Pfizer. So we know that if you're exposed, your body can still take up those droplets with the virus in it. You can still have infection, but overall that spectrum of disease is going to be much less than if you weren't vaccinated, and that's what...
And we know some patients will have underlying diseases that may prevent them from having a full response to the vaccine. But again, you tend not to get as sick, and so that's why 95% efficacy is so impressive. Hey, tomorrow, is there a COVID-19 stroke connection? Our experts explain why this is a complicated question that worries many neurologists and heart doctors. Our experts are Dr. Colleen Lechtenberg, a neurologist here at KU and the director of the Advanced Comprehensive Stroke Center, and Dr. Matt Jones, hospitalist in internal medicine. This will be a great program. These are two terrific folks. I think you'll enjoy having them with us tomorrow. So let's first go to Dr. Ryan Jacobsen. Ryan, final thoughts for today.
I'd just like to give a shout out to all the EMS providers that are working out there during this EMS week to take some time to do something enjoyable. You guys deserve it, and try to get some food at one of the local hospitals that's doing EMS week celebrations. So again, it's an honor and a privilege to serve aside these folks, and just my congratulations for surviving to this point, and you guys are true life-saving heroes.
Yeah, pretty good stuff.
I would also like to give a shout out to our EMS providers. EMS traffic, they represents about 25% of all patients brought to our emergency department. And and they provide a wonderful service. And this Thursday, our health system's hosting an EMS picnic over at Rosedale Park for all EMS providers in the greater Kansas City area. So please stop by, and we'd like to personally thank you for your service.
And I know I would like to thank all of you for your service, and all of you for your service, all the first responders, EMS providers. What an important thing just to recognize the great work of our EMS teams throughout our state and region and throughout our community have provided terrific service every day to people when they're most in need. I mean, you're so darn vulnerable at that moment that having good people come to you and take care of you and get you to a hospital, that is an incredible opportunity. You know, when you go to other countries, they don't have the sophisticated EMS program that we have, and it is a blessing, and we are blessed by y'all every day. So thank you for the great work you do. Final thoughts, Doc?
Yeah, you know, again, parents, guardians, friends, family, please continue to get everybody that's 12 and above vaccinated. It's going to help you individually and help our community. And I would just like to echo all those sentiments about our emergency department. Physicians, I'm friends with a few of them, our nurses, support staff, respiratory therapy, they are on the front line, they are the tip of the spear every day, keeping you safe, helping you in that immediate need of problems that you may have. So thank you very much.
And thanks to all of our team, and even Hawkeye with his Chicago Bears belt.
You know, I would like, after thought about it, you know, I think definitely having the Chiefs win would be a lot better because the party would be off the chain again.
There you go.
We need another one. We need another victory, Chiefs.
All right, we've talked a lot about asking your doctor about whether to get the vaccine. We've had the chair of OBGYN here, Dr. Carrie Weinecke, on several times on the program, and she has strongly advised her patients to get the COVID vaccine. She's also the mother of two boys, one age 12 and the other 14, who got their shots on Friday. Besides their mother's influence, here are Jack and Max explaining in their own words why they were among the first in line to get COVID-19.
Our safety data points that this is really a safe vaccine even for these younger teenage kids, and I think it's important for them to realize that they're helping society.
Because the vaccine seems like the quickest way to just go back to normal.
Just get it, it's not that bad, it's like 1 second and then it's all over.
Good advice from Jack and Max. Thank you guys for being a part of that program. Thanks for going out and getting that vaccine. Well done. We want to see more videos or photos of people like Jack and Max, or for that matter, Wyatt and Caroline. You can upload with Facebook Messenger to the Kansas Health System or send to us at medicalnewsnetwork@kumc.edu. Remember, we all want to get back to normal, but the only way to do that is for all of us to get vaccinated. We'll see you tomorrow.